The following segment is sponsored by Hologic. According to a new CDC report, cases of STIs continue to rise in this country, particularly among 15 to 24-year-olds. Yet many are undiagnosed and, if left untreated, can have serious health consequences such as infertility. Today, Dr. Bukowski, new medical doctor of diagnostic solutions and women's health company Hologic, is here to share the latest guidance called opt-out screening with a universal approach to help protect women and their health. So, doctor, what should we know about this new report and how can this new approach protect our health?
The CDC recently released their STI surveillance report for 2022, which showed yet again rising rates of chlamydia, gonorrhea, and other sexually transmitted infections, with over 2.5 million cases being identified, half of which are in young people aged 15 to 24. And the CDC specifically calls out that we need better and new strategies to address this epidemic, things like opt-out screening or universal screening. Screening needs to be an essential part of every regular checkup and preventative visit because STIs can happen to anybody regardless of background, and most patients are asymptomatic when they are diagnosed with an STI. We know that 1 in 2 people under the age of 25 will be diagnosed with an STI, and so we need to be having these conversations regularly because they can have life-altering consequences when not addressed appropriately. And because most of these infections are asymptomatic, we need to have regular visits with a healthcare provider to test for these infections. Now, I mentioned opt-out screening, which is one approach that the CDC suggests to address the rising rates of STIs in young people. And this is the concept of automatically testing 15 to 24-year-olds annually, regardless of their reported sexual activity, unless the patient declines. This reduces barriers and the stigma of testing, and the patient doesn't have to raise their hand and ask to be tested. It's just an automatic part of their healthcare visit. And studies show and support that this type of strategy does increase the rates of screening in patients, and hopefully this will get them the testing and treatment that they need. Now, if a provider doesn't automatically bring this up with their patients, patients need to be proactive. They need to ask for this screening at least annually or when they have a new partner, and whenever possible, be open and honest with their provider about what's going on in their life so they can get the best recommendation for their health. Now, if people need more information, I encourage them to visit www.hologic.com/wellwoman. We have a wealth of resources to help people prepare for their preventative visits on STI screening, cervical cancer screening, and ideally, they should talk to their provider and get the testing done that's recommended so that they can protect their health. Thank you so much for having me today.